Hello, my name is Mick Raich. I'm the president of Vachette Pathology and Stark Medical Auditing, and I want to talk to you today about some of the changes we're seeing taking place. We're not done with the pandemic. It's kind of like we're not done with the election. Things just seem to drag on this year, 2020. What can we say? But there are some interesting things taking place. There was a great letter from the American Hospital Association, which was sent out last week to a couple of the White House panels and task force on COVID, because what the hospitals are seeing is some very unique things. For example, they feel that the insurances across the nation, insurance providers across the nation are continuing to pursue strategies to boost their earnings even in this time of the pandemic. And it's really, really being difficult. Hospitals struggled for, as it was, with single-digit margins, and now their margins are going to be, the last prediction I heard was 10% down for the year. Now, some of the things that they see taking place, the AHA mentioned in their letter, was number one, denial of emergency services, denial of sepsis intervention coding, questionable reporting requirements, and utilization and management requirements that deny care. The big thing we're seeing, especially in the ER side, for example, Anthem came out and said that they can deny emergency services because the condition did not warrant an emergency case, and they do this not on what the care that was provided, but as the patient presented. Typically, the patient presents with something that they think is an emergent situation, and usually it's covered. But what they're saying is that if you come in with you think something's emergent and it's not emergent, well then they're not going to cover it. Classic example myself. About 3 months ago, I was speared in hockey, and I actually thought I lacerated my liver or my spleen. It was terrible. I went to the ER and got an MRI to check, and they said, no, you know what? Guess what? You're in luck. You're fine. Now that wouldn't have been covered because I didn't have a lacerated spleen or liver. So imagine that type of denial coming forward, and imagine that if we use that across all healthcare. We already have problems with ruling out things in healthcare, and those codes being non-paid. So this is just another way for them to say no. And now, at this time of all times, insurances should put aside their profit-generating concept and say, maybe this year we're going to try to be budget neutral, or maybe we're going to try to make a 5% margin instead of a 35% margin. And I have a lot of family in the ER that work there, so one of the things we're seeing is that when I talk to them is ER volumes are still down. I mean, they're only at 80% of what they were before COVID. A couple other things I wanted to talk about. MIPS bonuses. The good news is that most everyone's reporting everything they need to report for MIPS. The 2019 MIPS came out last Tuesday, and CMS unveiled its analysis of the quality payment program and merit-based incentive payment system participation, and they said basically this: everyone's doing a very good job of reporting, so the bonuses are really small. Remember, this is something where someone has to fail for one group to fail for the other group to make money. But if everyone does fine, then no one gets penalized or no one gets a bonus. That's good news, I guess. Let's talk about COVID. Boy, some huge changes in the COVID world. Number one, there's a great report that came out from Healthcare IT News that said telehealth is up a whopping 2,532%. So I don't think telehealth's going away. I think more and more patients are going to see their doctor over their iPhone or their iPad. I think CMS is going to find a way to pay for this. I'm not sure insurances will pay for it. It'd be interesting to see how they respond to this. Will they lower the CPT code revenue? Will they figure out a way not to pay for it? But that's going to be the way. We've taught everyone to be a touchless society for the last year almost. So it'll be interesting to see how this goes forward. Then another thing that came out, there's a big problem with some of the FDA testing. For example, top officials at the Department of Health and Human Services ended the agency's limited oversight of lab-developed coronavirus tests in mid-August, despite warnings the tests were faulty. According to an investigation that found that the federal regulators retained oversight authority to ensure labs met quality standards. The FDA has no way to track problems with lab-developed COVID tests. So, there's been about 200 of these lab-developed COVID tests. What they're saying is that they really have no way of tracking their effectiveness and how good they are. The FDA has granted emergency authorizations for more than 200 diagnostic tests for COVID-19, and one official estimated that half of those may be lab-developed tests, which are currently being used in many states to manage the virus. So tie that concept into a lab-developed test to what came out, what NILA came out, the National Independent Lab Association came out in late October and said, they sent a letter to the Health and Human Services seeking clarifications on the recent decision to cease review of these tests. So the FDA says no more emergency use authorization tests. And NILA says, well, sure, we might need some more LDTs as we go forward. Now, here's the interesting thing. We talk about something called the PrEP Act, which covers, it's the Public Readiness and Emergency Preparedness Act. This was amended in 2020 to cover these tests. Now, the PrEP Act encourages independent labs to respond to public health emergencies by limiting liability for in vitro diagnostics. However, this legal protection may not apply to laboratory tests that have not been approved or authorized by the FDA. By refusing to review COVID lab-developed tests for emergency use authorization, the FDA leaves laboratories without any avenue by which to secure PrEP Act protection for these COVID tests. So what we're looking at here is the PrEP Act kind of says, in an emergency, do this stuff, and we'll cover your liability. But now they're saying, well, if it's a lab-developed test, we might not cover that. So that question right there makes a big determination. Imagine you have a lab and you're doing 100,000 COVID tests a day through your own lab-developed test, and then you find out that something's wrong and you're open for a liability on that. That could be very interesting. That's the last point I want to hammer on here is we keep hearing that lab, Michigan had 100,000 positive tests this week. Yeah, but labs are ramping up now, baby. We're testing. There's labs out there doing 100,000 tests a day. So this is the good news. We have a way to look at this. We have a way to handle it. Hopefully we have a way to treat it. Will we get a way to get paid for it? Looking at this going forward, it's still a train wreck. We just wrote an article not too long ago about some of the billing issues we're seeing. Remember, we audited about 100 different hospitals and labs and practices around the nation. That's what Vachette and Stark does. We look at revenue. We don't do billing. We actually audit revenue. And we're finding a ton of stuff still being denied from back in April, May, being written off, being basically eliminated as bad debt. It's been a terrible year for healthcare, for not only for patient outcomes, but for financial outcomes. And going forward, I don't think we still have a game plan going forward. I'm fearful that we'll reach a point come February where we shut everything down again. And you look at the downstream effects of shutting things down, the number of cancer diagnoses that are stage 4 versus stage 2, the number of diagnostic tests, and basically just basic healthcare tests that aren't being done because of that are still being down or outplayed now. We work with a lot of pathology groups, and they're saying they're seeing an amazing number of stage 4 cancers that they never saw before in their life because people went 2.5 months without treatment. People were scared to go to the doctor. So we're not done with this on the medical side, obviously, and we're definitely not done with it on the financial side. So take a good look at your books, take a good look at where things are at. If you have questions, give us a call. We're seeing some of the nationally known billers in both the pathology, radiology, and hospital side just fail grotesquely. So if you're in that ballpark and you're worried, give us a call. We'd love to chat with you. Again, I'm Mick Raich. Thanks for taking a few minutes to listen to me, and enjoy your afternoon or your morning or your night, or enjoy your iced tea. Thank you.